Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to Newsroom. I'm your host, Khalid. But today is the 27th of April 2023, and these are the stories that we will be discussing during the course of the show. We will begin, ladies and gentlemen, with the relationship between the Islamic Republic of Pakistan and the People's Republic of China. We will be talking in detail about different aspects of this relationship in the context of A, the visit of our army chief currently to China, and also the telephonic conversation that our Premier Shehbaz Sharif Saab has had with his counterpart, Mr. Li Qiang, who is Premier of the State Council of the People's Republic of China. What were the important topics that were discussed? What were the assurances that were given from both the sides? How important is this relationship, whether it be in the context of CPEC or our defense or strategic partnership between the two countries? We'll be discussing that in detail as part of our first segment. Our second segment, ladies and gentlemen, concerns monkeypox. Now, this is something that we have been hearing of since 2022, but of late we are concentrating a little bit more on it because of the fact that we have had one case here in Islamabad that is of a patient that came from the Kingdom of Saudi Arabia. Although the necessary precautions have been taken by the NCOC, by the different airports across Pakistan, by the different institutes, including the National Institute of Health, we need to remain vigilant as far as the signs and symptoms are concerned, and be safe rather than be sorry. We'll be discussing the signs, the symptoms, the conditionalities around monkeypox, and how we can prevent ourselves and our loved ones from it. Our third story, ladies and gentlemen, also concerns more or less the WHO or the disease. Now, the World Health Organization has said that the consignment of unhealthy cough syrup that was made in India has been found in the Marshall Islands and Micronesia. Now, samples of cough syrup that were made in India contained a dangerous compound that is known as diethylene glycol and ethylene glycol, which can cause the death of those who drink it. Not the first time that Indian medicines from Indian companies have been stopped because of the harmful or deadly effects of that. We'll be discussing that as part of our third story. Let's begin with our first, and that concerns the relationship between the Islamic Republic of Pakistan and the People's Republic of China. It's a very important strategic relationship. We are brothers, as we've been called many a times, iron brothers. Our friendship has been called deepest than the deepest of oceans, higher than the highest of mountains. And China has time and again reiterated this very fact through siding by Pakistan in the good and the bad times. To discuss the relationship between these two countries in the context of the visit of the Chief of the Army Staff to China, as well as the telephonic conversation between both the premiers of Pakistan and China, we've been joined by Dr. Fazal Rehman. He's the director, Pakistan Institute of China Studies at the Sargodha University, and we have the chance to have him in the studios this time instead of on Skype. Thank you very much, Dr. Saab, to have joined us. It's a pleasure to have you here in the studios. As I said before the show, better to have a face-on-face conversation rather than online. The Pakistani Army Chief, General Asim Munir, is in China on a 4-day official visit. He was given a very warm welcome. He met many important personalities from China. What message, in your point of view, has been given, A, by Pakistan, and B, by China, through this gracious welcome and the different meetings?
Well, the relationship between Pakistan's armed forces and Chinese armed forces has been a backbone of Pakistan-China bilateral relation since we started our relationship way back in 1950s. And since then, it's an ever-evolving relationship, and we see that this has been a constant feature of Pakistan-China bilateral relations, that the military-to-military contact and relationship has been very cordial, very strategic, and both the countries have been calibrating their strategic vision and strategic policies in the past and at present also, and they are going to do the same in future as well. So I think from the point of view of the timing of this visit, it's very important because I think momentous changes are taking place in our region, especially in West Asia, in Central Asia, in Southeast Asia. And all these changes have implications both for Pakistan and China. Since Pakistan and China are strategic partners, and since the strategic vision of peace and stability we share with the Chinese vision of Belt and Road Initiative. We share the Chinese vision of global global security initiative, global development initiative, global civilizational initiative. So all these things combined together makes this visit very important in order to attain the understanding of the regional scenarios, of the global scenarios, because we see that the intensity of tensions between US and China are increasing, and they are going to certainly have implications for the South Asian region. Similarly, we see the relations with India are not really improving despite the efforts from the Chinese side to improve them, but there is kind of a rigidness shown on the Indian part, India being part of the Quad, India being part of the emerging alliance system with the US. So I think that this is time that Pakistan, China should come more closer in terms of security and defense related affairs of the region and of the globe. So from that point of view, I think this visit is going to bring about a deeper understanding between the two armed forces, between the two countries as well, regarding what to do in the future, what kind of challenges are.
Now, when you talk of challenges and what to do in the future, Dr. Saab, the first point comes to my mind is the official statement that was released, which said that both the military commanders, that is of Pakistan and China, reiterated the need to maintain peace and stability in the region and enhance military to military cooperation. You talked about the key geopolitical changes, geostrategic changes that are happening in the region and beyond as well. That was also stated in the statement. How can both our defense agencies and our armies work together in order to bring about peace in the region?
Well, there are actually several channels between the two countries' armed forces. There is a strategic dialogue between the two countries. There is cooperation on anti-terrorism, on extremism, on all the evil forces which can destabilize the region. Similarly, there is larger understanding, especially vis-a-vis the situation in Afghanistan. So we can collaborate in terms of doing some coordination at a diplomatic level. We can support certain initiatives which are aimed at bringing about peace and stability. We can help each other in negotiations, in initiation of negotiations on conflicting issues. And we should also look forward to find some common grounds with other countries also, which can bring stability and
both
peace.
The countries are part of many organizations. The SCO, for example, is a very important platform which can work together, and both these countries, that is China and Pakistan, are important partners as far as this is concerned, and so many other issues that both the countries can work on. And we have seen as China has always backed Pakistan, wherein other countries did not favor Pakistan in some issues, and China was always taking Pakistan's side. President Xi Jinping began his third 5-year term very recently, and there's a new Prime Minister, Mr. Li Qiang, with whom our Premier Shehbaz Sharif Saab also had a telephonic conversation today, in which the all-weather friendship and close friendship between the two countries, and also China's peaceful development as a positive factor of international peace and stability was discussed. We've seen also how China has been instrumental in bringing peace between of all countries, the Kingdom of Saudi Arabia and the Islamic Republic of Iran. There are also talks of China intermediating between Ukraine and Russia as well. How important do you feel the role of China is going to be in the future?
I think it has already become global. It has become global in a sense that China is mediating among the countries where all other instruments, global instruments, have not really worked very well. So China's efforts are seen by the international community as very positive, as very interesting in a sense that China is coming with some innovative solutions to the problems, and China has delivered also. If we look at the recent peace process in the Middle East between Kingdom of Saudi Arabia and Iran, I think it's a great achievement. It's a great achievement, and even it has forced the Israelis to rethink their policy towards the Middle Eastern countries. And perhaps this can unleash a new wave of accommodation, of peace, of stability in the Middle Eastern region, which can certainly contribute towards development of the region, and intra-state relations can improve definitely, and hostilities could cease. So it will give a great boost to China's Belt and Road Initiative, and while at the same time, but opening up some kind of windows of opportunity for Pakistan as well, being China's very close friends, ally, and also having very close, cordial, brotherly relations with the other countries in the Middle East. So I think it's a huge opportunity which is being created by China's peace initiative, and it can help Pakistan. But we have to really put our house in order and also craft kind of a very focused and very precise policies.
Before I talk about Pakistan putting its house in order, and I understand what you are referring to, I would like to also understand the threats that are posed because of Afghanistan and the terrorist elements that operate from there, whether it be ETIM that China is has time and again told Afghanistan about, whether it be the TTP, whether it be the ISKP. There are so many such terrorist outfits that are operating from within Afghanistan and pose a threat to the region. Can the defense partnership between China and Pakistan lead to a better coordinated counter-terrorism efforts against such organizations?
Absolutely. I think we have been cooperating with each other. If you look at the history of Pakistan, China's anti-terrorism, anti-extremism coordination and cooperation, it has started sort of many years back, and we have learned from each other's experiences. We share real-time information with each other, and we try to help each other countering their respective threats. And these threats are not only excluded or isolated for China or for Pakistan. I think these are the threats which are being posed by these terrorist outfits to the regional peace and stability. So in terms of achieving, enhancing regional peace and stability, I think Pakistan and China can certainly have coordinated efforts and can lead these efforts, and also involve the other countries, the neighboring countries of Afghanistan, and also can be the platform of SCO can also be used for this purpose. And I think there is already an SCO Afghanistan contact group which is working and trying to sort of facilitate certain kind of dialogue. But I think that Afghans should also come forward in terms of meeting the expectations of their neighbors, their neighboring countries, and try to deliver on part of on their part towards settling down the basic requirements which are more acceptable to international community, to the neighboring countries also.
You talk of acceptability. Let's talk about certain Chinese apprehensions that regard the security of the Chinese workers in Pakistan. In your point of view, what are the key assurances that could be given by Pakistan during the visit of our army chief, and also during the telephonic conversation between the two leaders now and in the future?
I think, sort of to be very candid on that, I think we have not been able to really give absolute or foolproof security to the Chinese projects and to the Chinese workers in Pakistan. And I think this is our responsibility, as we have been promising with the Chinese side, that we are trying our best. Though we did try our best, there is, there can't be a second thought on that. But the thing is that there could be, sort of something more added to it, which can ensure, for example, in my university, there is a Confucius Institute, and since the Chinese incident in Karachi, all the staff of the Confucius Institutes from Pakistan, there are 5 Confucius Institutes in Pakistan, that has been withdrawn, and since then they have not come back because there is no security guarantees given to the Chinese side. To some private companies which are running some private businesses, when they ask for the security, they have been told they should engage some private security companies for their security and things like that. So I think that needs to be this issue needs to be addressed. We should try to take this issue of Chinese personals and their project security very seriously, because if we are unable to do that, I think the further Chinese investment may not be sort of coming to us as we are expecting, and this would be one of the instrumental, one of the very basic component of progress of CPEC. If we cannot, or if we are unable to provide.
But I think those assurances will be given or have already been given, if not yet. I would also like to understand this visit of our army chief to China is being very closely followed by our not so friendly neighbor India, as well as the West, because this in their point of view, is going to determine Pakistan's future strategy as far as this tussle between Beijing and Washington is concerned. Do you feel Pakistan can play a neutral role and have equally good relations with both the US and China?
Well, to my understanding, I think it will be very difficult for a country like Pakistan, who is a very important ally, strategic partner of a neighboring country, China, which is again, sort of a global player, to play a neutral with a power which is located at a distance, and we seek our security from within the region. I think our security lies within the region, because if you look at our security dynamics, it's on the east it's India, on the west it is Afghanistan, on the other side it is Iran, and all these sort of the security milieu is really driven by our regional dynamics. So I think China Pakistan partnership is very natural, and I think we should open up that kind of a position that we will try to play neutral. It will be very difficult for Pakistan to play neutral.
Let's see how
that will not be acceptable by the other side.
All right, let's see. Only time can tell. Referring to the conversation between Mr. Li Qiang and Mr. Shehbaz Sharif, Mr. Li Qiang said that China is going to continue to stand with Pakistan at all times. How important is the timing of this statement, of this assertion by China?
I think Pakistan is passing through the worst ever crisis, domestic crisis situation, where the different institutions of the state power are being are not functioning in a coordinated way, which should have been the case, and that has created a kind of a chaos or chaotic situation, not only within the country but for the observers who are seeing Pakistan from the outside. China being a very close friend and brotherly country of Pakistan, they do understand the local political dynamics in this country, because they have been one of the country which has been supporting Pakistan not only economically, politically, internationally, and also strategically, and at all levels they are, and they're concerned about the well-being of Pakistan. They're concerned about the ongoing political, economic crisis in Pakistan. They are trying their best to help, but as a matter of policy, China doesn't interfere into the internal affairs of any other country. So all they can show is their solidarity with the country. They can show their solidarity with the people, and they can reiterate their support for Pakistan, not for any particular group or party.
Now, you talk of reiterating support. Let me also include the principled position that both Pakistan and China have taken on certain key issues regarding both the countries that have been reiterated during this telephonic conversation between the two premiers. From the Pakistani side, the One China policy of Taiwan, Tibet, Xinjiang, Hong Kong, and the South China Sea, and from the Chinese side, the principled stand on the illegally occupied Jammu and Kashmir issue. How important is this mutual understanding and this position that both the countries have taken?
Well, basically both the countries have reiterated their position on the core national interests of each other. So I think from that point of view, it is very important to understand that both the countries will stand by each other as far as their core national interests are concerned. So they are not going to deviate under any circumstances from supporting each other on these issues. So I think it's a very categorical, very open, and very concerted support extended to each other during this conversation.
We know all about the tussle between India and China. We know about the tussle between China and the United States of America. We know that the Asia-Pacific policy of the United States of America includes India as its core partner in the region. How important now is this strategic partnership between China and Pakistan under the current geopolitical scenario?
Well, actually, China is very much concerned about its security, from the immediate neighbors, from the neighborhood region, and Pakistan forms one of the very critical portion of its regional security. Pakistan can extend certain assistance and help to China in securing at least this part of now if you see that the United States policy is basically hedging China through its neighborhood. Now they are re-engaging with Vietnam, they are re-engaging with Mongolia, they are re-engaging with sort of other neighbors of China in order to create a kind of instability in the first tier of China's immediate defenses. So I think from that point of view, Pakistan is very crucial. Pakistan can play a very important role, and China fully trusts and relies on Pakistan as far as the Pakistani commitment towards China's security and safeguarding China's interest within the region to the maximum possibility that Pakistan could do.
Dr. Fazal Rehman, final question. During the conversation between Mr. Li Qiang and Mr. Shehbaz Sharif, both the leaders agreed to enhance cooperation in all spheres to realize the shared objectives of benefiting people of their countries while also contributing to regional peace, prosperity and stability, quote unquote. What are the areas of cooperation that need to be enhanced in your point of view? We already have a lot of areas of cooperation, but are there certain points where we could enhance, further strengthen our collaboration and our friendship?
Well, certainly the first thing is that China's all the policies are drafted around the core interest of the people. They are people-centric approach in their policies. So I think we should also learn from the Chinese experience and make all our policies people-centric.
All right.
Now, as far as the benefiting, from each other in terms of well-being of the people, I think we have to stick to the successful implementation of CPEC, because it's a comprehensive framework for cooperation.
And it's very important for Pakistan as well, for its economic future.
Basically, it is much more important for Pakistan now, especially given the Pakistan's economic situation. This climate change is impacting Pakistan's agriculture. Our industrialization has not really been reformed or restructured. We need to do that, because unless until we produce surplus, exportable commodities, we will not be able to earn foreign exchange, and if we do not earn foreign exchange, I think we are not creating wealth. So we have to create wealth and make this country, more progressive and sort of more developed.
Well, let's hope for that, because on the current context of this visit of our army chief, as well as the telephonic conversation and all the previous conversations that our leaders have had, it's only points towards one thing, and that the friendship, the collaboration, the cooperation is only strengthening with each passing day, where both the countries understand each other's concerns and want to work together in order to stabilize not only their respective countries but the region as well. Thank you very much, Dr. Fazal Rehman, Director, Pakistan Institute of China Studies, Sargodha University, to have joined us and to have come to the studios of all things. Thank you very much, sir. Let's come to our second segment, ladies and gentlemen, that concerns monkeypox. No need to be afraid, although it's not as virulent as COVID-19 might be. You don't get it through droplet infections. Nevertheless, there are certain concerns that we need to address and certain precautions that we need to take. We've had our first case in Islamabad of a patient that came from the Kingdom of Saudi Arabia, who was a driver in Jeddah. And of course, he has been localized, he has been transferred to PIMS. Nevertheless, with the fact that this is a contagious disease, we need to be careful. We'll be discussing different aspects of that, but before that, a short package.
The rapid spread of monkeypox is raising alarm about threat of another health emergency, and since January 2022, cases of monkeypox have been reported to World Health Organization from 110 member states across all 6 WHO regions. Monkeypox got its name in 1958 when it was detected in several lab apes. It is a zoonotic viral disease, which means it can be transmitted from animals to humans. It can also pass from human to human. Symptoms usually include fever, severe headache, muscle aches, back pain, low energy, swollen lymph nodes, and skin rashes. Health institutions and establishments are put on high alert throughout Pakistan to contain the spread of virus, whereas according to NHS, there is no evidence of localized transmission of monkeypox. The Ministry of National Health Services is monitoring the situation both at national as well as global level and keeping all relevant stakeholders on board for ensuring preparedness, timely response, and containment of monkeypox cases in the country. Pakistan has also decided to request the World Health Organization to provide vaccines for the prevention of monkeypox after 2 people were found infected with the virus. The continuing risk of stigma and discrimination, weak health system in some developing countries leading to underreporting, the lack of equitable access to diagnostics, antivirals, and vaccines indicate greater health impact of monkeypox.
Rana, Jawad, Asghar, leading epidemiologist and a good friend and a good guest of ours on a newsroom, joins us online. Dr. Saab, we had been talking since so many years, but there was a lull, and now welcome back. You were the first one who talked about monkeypox around a year back when the first case was detected in India. You had said it won't be long before a case comes in Pakistan, and now we have our first case in PIMS. How dangerous is monkeypox, Dr. Saab?
Thank you very much, Omar Saab, for inviting me, and it's a pleasure. Monkeypox is a serious disease. It's the same virus which the smallpox virus family. So it is a serious disease, but it is less severe than, say, smallpox, which was a devastating disease. And it's also less severe, in my personal opinion, than COVID-19, because this is a controllable disease. So you can localize it if you had a good contact investigation, you have good infection control practices, you can control the situation much more easily than, for example, we were facing in COVID.
All right, Dr. Saab, why are health experts concerned this time around as far as monkeypox is concerned? We know that most of the cases reported so far have been in the United Kingdom, in Spain, in Portugal, in Canada, Australia, single case in Boston in the United States of America, in India, and now in Pakistan. Should the world community be concerned? Because the World Health Organization is.
Yes, and the reason is that until like last year, when this 2022 outbreak of monkeypox started, nearly all the cases were exclusively coming from a few African countries in a small region. So it was easy to control that disease. We knew about it. Vaccines were there. So if there are like localized outbreaks, we were able to control those. There were certain cases in Western countries before, before even just last year, but they were always linked with the travel to Africa. This time around, when the 2022 outbreak started, it started from Europe, and still today, the bulk of the cases are coming from American country, different American countries, different European countries. So it's not African side from where traditionally for last 40, 50 years the cases were coming. So that's, I think, raised the concern. Also, in last 1 year alone, there have been 87,000 cases identified from 110 countries and 112 deaths. That shows the virus has actually sort of, find a way to infect us in a better way outside its traditional home base.
All right, Dr. Saab, should we consider monkeypox as the next pandemic, or is it too early?
No, I don't think so. Not every virus or every serious disease could act as a pandemic. It will become pandemic if we really fail, on every aspect of disease control. And the basic difference between this and COVID-19 is this, that in COVID-19 situation was an airborne disease. So you breathe in viruses which were already in the room and you got infected. Second thing was around 50% of COVID-19 patients were asymptomatics, like they had no symptom, they didn't know they are sick, but still were able to infect others. These two things make controlling a disease very difficult. In this disease, there are visible, you have blisters, you have fever, you are sick once you are infectious. So I think.
All right, you talk of blisters, Dr. Saab, I'd like to understand the transmission from one person to the other or animals to humans. Is it through these lesions or is it through other forms of contact?
All form of contacts, including body fluids, if the bedding of that infected person. So if you remember once when COVID-19 started, at that time we were thinking about that COVID-19 is a droplet infection. And that's why you saw all those precautions, which was washing your hands, cleaning the surfaces. For this, we know that it is a droplet-based infection. And so all those precautions need to be used here.
All right, Dr. Saab, a lot of people say that the incubation period, during the incubation period of monkeypox, it cannot be transmitted from one person to the other. Is that true? Is that only when the lesions start appearing that the person becomes contagious?
Yes, that's why I think what we feel that it can't be the next pandemic. It could be very serious disease, and I don't want to undermine the seriousness of this disease, because in countries like us, if one person of COVID-19 comes to routine hospitals and the way the infection control practices are there, which is like really bad situation, so there is a danger of that one person infecting so many more people. So we need to make sure that our hospitals have a proper isolation wards, infection control practices. So if a person who has a suspected case comes to those places, it is not become a source of a new localized outbreak.
You talk of the spike in the number of cases. You said since 2022 there have been more than 87,000 cases, in fact 87,113 cases, and more than 100 deaths that have been reported. But what is the reason behind the spike in the number of cases? Is it because of climate change? Is it because of increased travel or other factors?
Not sure, but increase in travel is certainly one reason. And as you know, this is, still predominant cases are coming from a high-risk group, which had some of their events planned in Europe last year, from which this, this infection then spread all over the world. But I just want to caution everyone, because once we start using the word high-risk group, then everyone else start thinking, I am not that high-risk group, so I can't be infected with this virus. Actually, that does not happen. Every disease, especially sexually transmitted disease, start with the high-risk group and then later spreads to every other part of the population. I give you an example. HIV/AIDS first was identified in homosexual peoples in San Francisco, but after the years now, you have innocent children infected, the pregnant mothers infected. So only in the beginning we see those things, but later there is no guarantee that someone having a different risk profile will not get that infection. So we as a population should not underestimate the risk it may cause to everyone.
Dr. Jawad, if we should not underestimate the risk that it may cause, what are the precautions that we need to take, especially in a country like Pakistan? People like myself, people like yourself, people like the viewers who are listening to us.
Because whenever we talk about any new disease or new form of that disease, we think about its epidemiology. So what is the epidemiology of current outbreak of 2022? It's predominantly in high-risk group of men who have multiple sexual partners, including same gender partners. So anyone who is highly active sexually with multiple partners should be concerned if there is a rash or any vesicles on their body, and if that happens, isolate themselves and then get proper medical advice on that. And especially if you are an adult man and you get those rash or vesicles on your body, normally that does not happen in adults. So it's normally happen in kids, that's a routine, but if you are an adult and you are having those, you should get it checked from a proper healthcare center.
All right. Dr. Saab, we also want to understand about the vaccines. I went to the site of the CDC and they note two vaccines. The first is the replication deficient modified vaccine, Vaccinia Ankara, the MVA vaccine, and of course the JYNNEOS, also known as Imvamune or Imvanex vaccine. Are these two vaccines able to control the spread of monkeypox? Can it prevent us from not having monkeypox?
So number one, these vaccines are actually, the vaccines which were developed for smallpox. And this is like their second generation of the same lines, and they are effective against this monkeypox. But remember this, the vaccines are not recommended for general population. Vaccines are only until now are recommended or being used in either the high-risk group or either the healthcare staff who deals with those patients. Out of these two groups, this is not being recommended anywhere in the world.
All right, that is interesting to note, because the more questions, the more people have, more and more queries, and the more we need to clarify things specifically when it concerns diseases such as monkeypox. How do you view the different precautions that the Pakistani government has taken, whether it be at the airport, whether it be the alert in hospitals across Punjab and across Sindh are concerned, whether it be Pakistan approaching the World Health Organization for the vaccine as well? Do you feel these measures are adequate as far as Pakistan is concerned? Official
I would say
measures
the measures are in the right direction. I would say that. And but remember, airport health staff cannot stop the transmission of any viral disease coming into your country. So there is a limited value of healthcare staff which we place on different port of entries. And this is a global studies done that there is a very limited value, but they are good in raise awareness among incoming patients about these viruses. Second thing, I think the most important which the government is doing, and I think should focus more on it, is improving the infection control practices in our hospitals, especially the major hospitals. Currently, the situation is not good, and Pakistan does not pass on infection control practices pretty much every hospital, including with some exceptions. Even the expensive private hospitals do not pass those infection control practices measures. So we need to focus on it. We need to improve our isolation facilities, that if a person comes, it does not start new outbreaks from that site. And the third thing is, yes, awareness is important. And I think the third most important thing is what you are doing at this moment is raising awareness through media. And so people are aware that if they, there is no need to panic, but if they see something, something happening on their skin, get it checked.
We've seen the deaths that were caused by COVID-19, Dr. Saab. Is monkeypox as lethal? And because there have been more than 100 deaths, as you yourself have said, in the last year or so, but is it as lethal as, say, other diseases? Should people be afraid of monkeypox? You said we should not panic. Could you highlight the aspect of the lethality of the monkeypox?
So proper timely diagnosis can decrease your risk of dying. And remember, there are certain groups, for example, vulnerable groups. For example, if you are using the cancer medicine, so your immune system is already depressed. So anyone whose immune system is depressed, and if they get monkeypox, they can have a serious complications. So timely diagnosis and treatment is important. There is no magic bullet for it also, like specific treatment, but management is important. And the biggest thing is to ensure that one person does not spread it to 10 more people. That is a major problem. We can deal with a couple of patients, but if become a major problem, then it will be a trouble for us.
The issue with our society is that we are a very social public in Pakistan. Whenever somebody falls ill, everybody wants to go and visit that person and say, oh, I hope you get better. What precautions should one take? What are the symptoms and signs, apart from the lesions, that when people see, she should immediately either isolate themselves or tell that patient to isolate himself or herself in his or her room?
So simple isolation within your room will be a great benefit to not only to you, but your family also. Because they will stay protected. And it's, just making sure that any attendant who's, assisting that patient should wear all the infection control, take those personal protective measures like gloves, like mask, and make sure that all the, the bedding, the clothing, the utensils, everything are separated and they are cleaned properly in a sanitized way, number one. Number two is that, please do not visit any patient. It's not like Ebola or something like this, but there was a study done after an Ebola outbreak, like the first time when that happened, and they realized if you just visit the hospital for any other reason, your risk of dying was like 7 times more than someone who has not visited the hospital. So and if you have got injection there for any reason, this multiplied your risk. So please do not visit because that create problems for the patient, their family. Send them good wishes and restrict the personal interaction with that patient until a physician tells you that that's fine to interact. So that's very critical. Do not visit a patient house because you're increasing your own risk.
Dr. Saab, apart from the lesions, what are the other signs and symptoms of monkeypox?
So they are non-specific. So the other one is the lymph nodes are swollen, which people say is, they will feel something swollen in their body. Fever, weakness is another major sign of it. But if you remember, like all the viral diseases have pretty much similar symptoms. Only which thing is separated from other viral diseases, it's rash and those vesicles and pustules.
Dr. Saab, how long should a patient stay isolated in a room before he can roam freely outside or meet his relatives or his friends?
It depends, very much likely on the condition of the patient, the situation of their, those vesicles, the pustules, are they dry or not dry yet? So I would say that decision has to be left to the treating physician, because if the the papules or the vesicles or all those things are not dry, that means the person has still will be infecting others.
Are there any local remedies as far as monkeypox is concerned? We all talk about, herbal medicine. A lot of people believe in homeopathy as well. A lot of people, here go to alternative medicine as well. What should your message be to those people in case any relative or any friend of theirs gets the monkeypox?
So nearly most of the viral diseases which we see actually does not require, or at least we don't have, specific treatments for them. The only thing which is recommended for them to ensure their, because it's these are summer days, to ensure they are not dehydrated, their water, there's whatever is needed in their bodies, they are not hungry, they are not thirsty, all those kind of things. And if they have a fever, so we do what we call symptomatic management of the patient, ensuring the person is comfortable and body recovers. As you see, out of the 87,000, only 112 deaths are. So that means most of the people will recover. But our issue is not that it does not create problems for a bigger part of the population.
And that is very important. I understand the concern that you have, and I hope that whosoever is listening understands this perspective as well and follows your precautions carefully. Finally, the lesions. Last question to you, Dr. Saab. The lesions, where do they exactly appear, first of all? Where should we, see and, be a bit wary of if we see that in a person? Does it come on the hands? Does it come on the forearms, on the face, on the neck, or some body parts that we cannot see?
There are at this moment there are many like charts being circulated that how the vesicles which appear in chickenpox and measles and monkeypox are different, which thing starts. But I can tell you one thing very clearly: that every disease is variable in each person. So, for example, in some people with monkeypox, there may be one or two small papules and you may not notice anything else. And for some, there will be much, worse disease pattern. And when people are looking for those very clearly defined, events, they may miss the actual situation. So my advice is that if you are an adult man, and if you see a rash or any, on your body, and it could be at any place, any vesicles or pustules coming up, get it checked.
What kind of a rash? Because, I would like our public to also understand what kind of a rash, because there are different kinds of rashes. The rash that a mosquito bite gives us, the rash that any other insect bite gives us, or the rash that chickenpox gives us.
So it's a widespread, you will see a widespread on bigger part of your body, the rash, and then the papules will, come up.
the pustules will come out. Thank you so very much, Dr. Rana, Jawad, Asghar, leading epidemiologist, to have talked to us about monkeypox and of course the need to not panic but to take the necessary precautions so that those who have it can be isolated and not many can get it one way or the other through it. And of course, Dr. Rana, Jawad has ably described what precautions we need to take in case that happens. No need to worry, just take the necessary precautions and follow the signs and symptoms. If you or anybody near you starts to get these vesicles or these pustules, and inform the nearest doctor and isolate that person. Finally, ladies and gentlemen, we'll also end with something that is related to the world of health, but also related to India. Now, the World Health Organization has issued an alert over an India-made cough syrup that has been found in the Marshall Islands and Micronesia. It has been contaminated, and the tested samples of this medicine, guaifenesin TG syrup that was made by Punjab-based QP Pharmachem Limited, has shown amounts of diethylene glycol and ethylene glycol, which are extremely harmful for human health and cause death as well. The syrup has been marked by Trillium Pharma, that is based in Haryana state, although there has been no official statement from the company itself. But looking at the past of the Indian pharmaceutical industry, we know that India is the world's largest exporter of generic drugs. Many Indian firms have come under scrutiny for the quality of their drugs. The WHO also linked cough syrups made in India to child deaths in the Gambia and Uzbekistan. In October, it had also sounded a global alert and linked 4 cough syrups made by the Maiden Pharmaceuticals to the death of 66 children from kidney disease in Gambia, although these allegations have been denied. And also in March, India cancelled the manufacturing license of a firm whose cough syrups were linked to 18 child deaths in Uzbekistan. Also earlier this month, the FDA has said it has found that the Indian manufacturer of eye drops were linked to 3 deaths and serious infections in the US and had violated many of the safety norms in the United States of America. Be very careful, but at the same time be very vigilant of these marks and these syrups. Do not take them, and wherever you are in the world, we've just given you the name of the syrups and the eye drops. Do not take them. Always ask for your physician and ask his advice whenever you take any kinds of medicine. With that, we come to an end of today's newsroom. We'll see you inshallah tomorrow with new stories and segments that pertain to us, you and Pakistan. Stay safe. Allah Hafiz.